Hello, my name is Nisi Reed, and this is my presentation on the physics and physicals of mirrors. Strokes have been increasing globally due to population aging and growth. It remains the second leading cause of death in the world, and the bulk of global stroke burden resides in lower income countries. The effects are often sudden physical, cognitive, and emotional changes. Given where a bulk of strokes occur, surgical treatment can cause great debt to accumulate, therefore, there is a need for cost effective rehabilitation treatment. Mirrors solve this as they are a one-time purchase and very affordable. But how do they work? Mirrors create images because of how light reflects off surface. According to the law of reflection, light rays hit the mirror and bounces off at equal angles. In a flat mirror, at least two reflected rays are traced and they appear to come from a point behind the mirror. This creates what's called a virtual image, meaning the light doesn't actually meet there, but our brain perceives it as if it does. Because of this geometry, the image forms the same distance behind the mirror as the object is in front, with the same size and upright orientation. This is why mirrors produce accurate, perfect images. They preserve proportional and spatial relationships due to consistent reflection of light rays, which is very important for the application of medicine. Mirror therapy is a rehabilitation technique for stroke survivors that uses a mirror to create a visual illusion of movement in a paralyzed or weak limb. By moving the unaffected limb while watching its reflection, the brain is tricked into believing the affected limb is moving, which helps stimulate neuroplasticity, improve motor function, and reduce pain. That means it is important that mirrors create a perfect image of the limb in order to trick the brain. This is done by following the concepts of physics. Cost-effective treatment for stroke survivors are essential because recovery often requires long-term care, including physical therapy, assistive devices, and ongoing medical support. Stroke is one of the leading causes of disability, and without affordable options, many patients may not receive the consistent therapy needed to regain movement and independence. High costs can also place a significant financial burden on families and healthcare systems, limiting access to care and widening health disparities. By focusing on treatments that are both effective and low cost, such as mirror therapy, providers can help more patients participate in rehabilitation, improve outcomes, and reduce the overall economic strain while still delivering meaningful recovery benefits.